People focus on the eyes. It's kind of the center of attention when you're talking to somebody. And so whether they appear tired or rested can really give an overall indication to that person's age, demeanor, mood, things like that. So eyelid surgery can be very, very rejuvenating, even though it's a relatively quick, simple procedure.
I felt like the last 10 years, just feeling like a little bit of sagginess going on in the eyes, and I just wanted my eyes more open.
An upper blepharoplasty is basically when we take an extra pinch of skin off of the upper eyelid. When it starts to look heavy, the skin starts to hang over the eyelash line. It can appear full and just make somebody appear more tired than they are. Basically, in an upper blepharoplasty, we trim off that excess skin so that the scar hides right in the natural fold of the upper eyelid. And it reduces some of the fullness and heaviness of the upper eyelid and gives a more rested, rejuvenated appearance. So Sherry came in complaining of fullness and heaviness of her upper eyelids that she felt like was making her look tired all the time.
There was a little bit of sagginess going on and just hanging a little over, protruding down.
She wanted to keep it simple, wanted to do a quick in and out in the office. And so we just did the upper blepharoplasty procedure in her, and she got a nice improvement of the upper eyelid. So when patients have the upper blepharoplasty done in the office, what they'll do is come in, we'll give them a little bit of oral sedation. We'll draw out the area of skin that we plan to resect, so I'll mark that out carefully with the patient sitting up before the procedure starts. We'll inject numbing medicine into the area that we're going to treat. And then we'll trim out the area of excess skin, and we'll also reduce some of the muscle and the fatty tissue that's under that skin as well, just to debulk the heaviness of the upper eyelid. In total, the patients usually are in and out in about an hour, and the procedure itself takes about 15-20 minutes on each side.
It was comforting to me to know that I can have this through local, and within 20 minutes on each eye we were done.
So Sherry's results were very typical of patients that have this procedure. It's a very natural outcome. You don't see any visible scars, and it's very subtle, so not everybody notices. They just notice that you look more rested, less fatigued, because that fullness and heaviness of the upper eyelids is reduced quite a bit.